Hey everybody, it's Phil Jacobus. It's the 2nd of September. It's lunchtime. I'm on vacation, so forgive the casual attire. I'm here at my home in the country. And today I'm going to interview Rick Ferreira, or play a recording of an interview I did with Rick Ferreira. Rick's an interesting guy. He's one of those fellows who you feel like he's always 3 steps ahead of you, waiting for you to catch up. It's a controversial interview, so I'm sure you'll want to watch it. However, before we go to Rick, let's talk just a little bit about some things that will occur that are in our news this week. First, there is a story about the process of disinfecting MRI coils and why it's important, and that really is a timely story, I think, and something that I think you'll learn from. I think the most interesting story, whether you are a proponent of Black Lives Matter or All Lives Matter, here is a story that was done by University of California in San Francisco that suggests that Black children are 3 times less likely to be treated by protons than white children. Now, this is interesting because almost universally, if you ask a oncologist what's the preferred treatment under certain circumstances for children, they universally agree that it's proton therapy for the reasons that you might be familiar with. So this is an important story, it's timely, and I encourage you to read it.
All right, as promised, I'm joined today by Rick Ferreira. Rick, thank you very much for joining us.
Good morning, Phil. How are you?
Very good. You know, Rick is a very interesting guy. I've had the pleasure to have dinner with him, and he is very outspoken and interesting, and he's always 5 steps ahead of you. At least that's the way I feel. Rick is currently the CEO of Innovative Health, which is a reprocessing company. And he has been in the industry since 1996. He sold a company for a bundle of dough, but he stayed in the industry. So Rick, we'll talk a little bit about reprocessing today. Tell me, in a COVID world, how is reprocessing helping?
Well, I think, Phil, and what we saw through the COVID crisis was really how fragile the supply chain is within the hospitals, both from an availability of product and just the financial strain on facilities. Just read a recent article, I think it was from the AHA, that said hospitals have lost $200 billion since COVID hit through the end of July. So just, I think, been a massive impact to the hospitals. And we've seen an uptick in our business as more hospitals are looking to make sure that they're using their resources the right way. And still, today, reprocessing can still yield significant savings for hospitals, especially in some of these high-priced procedures like electrophysiology, the treating of AFib.
Now, you say a fragile supply chain. You mean that it's hard for for companies that manufacture abroad to receive their products so that they can sell them to hospitals?
Absolutely, absolutely. And also the ability, sorry, Phil, also the ability to be able to help the hospitals out in times of need, right? Not being able to give them additional rebates or be able to give them some price concessions to get them through these tough times. You've heard me say this before, as constituents in healthcare, we all need to do things differently. You and I as patients, the hospitals, and the vendors and partners that sell into the hospitals. We all have to act and behave a little bit differently if we're going to be able to solve this issue here.
Now, I know at dinner we talked about how hospitals really only have 2 levers that they can pull, their staff and what they spend.
Absolutely. I think, again, it's the 2 things that they really have ultimate control over is their labor and their supply costs. And I think we've seen for years the bloodletting of the labor end of it because it's easy. If I've got to save $1 million and I let 10 people go at $100,000 a year, I've just saved $1 million. And I've been a big proponent of let's look at where we're spending our money on supplies and are we getting the best value for what we're paying for?
Now, I assume that a reprocessed item costs less over time. What about timing? If how fast can you deliver?
Well, for us in our new business at Innovative Health, we were focused as a specialty reprocessor in the electrophysiology arena, and we're returning products back to customers in about 9 days. So if I'm picking up at a facility every week, by the second week of a program, I'm getting the hospital back 1 week's worth of product. So, pretty
Do
quick.
hospitals typically have 2 or 3 weeks worth of product in their inventory?
Typically, I think years ago we saw more inventory being held at the hospital, and as everybody got under financial pressure, there's been a big push towards just-in-time inventory. And I think we saw through this COVID crisis some hospitals that were really thin on inventory. As soon as there was a disruption in the supply chain, the domino effect hit them back where they weren't able to get access to product.
Now, what about logistics? The supply chain is a problem for healthcare for the manufacturers. Are logistics a problem for reprocessors? In other words, going and picking up the goods and returning them.
No, I think on some of our hospitals, we've had to change how we've collected the product. So instead of actually physically going into the lab, we've picked up on the loading dock, but we've accommodated our customers' requests as everybody's kind of navigating these waters for the first time on COVID, right? Should you have visitors in the hospital? Should you not have visitors in the hospital? But we've been very, very flexible and being able to accommodate those needs.
And you use your own trucks, or I mean, is it Federal Express or UPS or?
Yeah, both those mechanisms, absolutely. Our products are grossly decontaminated in the hospital, so they're safe and effective to be able to ship by UPS or FedEx.
Okay, and that hasn't been a problem.
I think they've had challenges as well. I think we've all had experiences, whether we've been ordering on Amazon or somewhere else, that things just aren't getting to us in time. I think again, COVID put a big crunch on everybody.
If I may ask, what in a post-COVID world, what things stand in the way of reprocessing becoming a more robust industry?
I think, Phil, things haven't changed. I mean, since 1996, our battle has been with the original equipment manufacturers and their unwillingness to actually embrace reprocessing. Both all the companies that were in this space prior to us getting back into it were owned now by big manufacturers, right? Stryker owns their own reprocessing business that they bought from us and are doing very well with it. Ethicon, J&J bought another competitor called SterilMed, and I think they seem to be doing okay with that business. Interestingly enough, they both don't spend a lot of time reprocessing their own product. So I think if we look at it in the real world for wallet share, the issue is every device that I reprocess is one less sale for the manufacturer. And instead of embracing and figuring out a way to help their hospitals be able to save more money to maybe buy more of these expensive devices from them, they tend to thwart it. I think, you and I, spoken about our recent battle with Medtronic. We had it with US Surgical back in the 90s. We had it with Ethicon in the early 2000s. And now Medtronic's raised their head, really spouting false statements about reprocessing product, about the safety and efficacy. Let's remember, we've had 2 GAO reports on reprocessing, both of them supportive. Yet today the manufacturers still continue to say, you can't clean the device. We know how to make the device. It can't be done, which is not true. We have to meet, I would argue, more rigorous standards than the manufacturer, because we've got to show that we can clean the device and sterilize it and have it still function like it did as a brand new device. And we're going through the same FDA branch that they go through. So how can the FDA branch be terrible for reprocessing, but great for the new devices? So we try to continue to highlight that out. And you saw my recent blog on that.
Yeah, I noticed that. That you made a blog on LinkedIn on this topic. So you mentioned that some devices cost less in Canada than in the United States. Do you have any idea why that is? And can you give an example of that?
Well, not that I'm advocating a single payer system, but in Canada, you have a single payer system. So the government is basically setting the price that they're willing to pay for a product, and the manufacturers have to meet that price or they don't get to play in that space.
Right.
I mean, we've talked here in the US, it's unconscionable to me how 2 facilities on the same street can both be paying a different price for the exact same product. And that's where the waste comes into in the system.
Well, given the stress that healthcare providers are under at this current time and the savings that reprocessing represents, I'm first of all glad that some of the manufacturers have started their own reprocessing business or inherited or purchased one. And I hope that that industry continues to prosper, because God knows we need to save money. Do you have any, you're an insightful guy. What is your view about the future? Do you believe, how long do you think we're going to be under the spell of COVID?
Well, I think we're still going to see these spikes until we have a vaccination for this. So whether that's 6 months, 12 months, 18 months, I think we all have to realize we're living in a different world, even going forward, right? Like today, you and I would normally have sat down and had a meeting at this time. We're now doing it over Zoom. So I think you'll see, less conventions, less in-person meetings. And I think you'll continue to see these spikes as states open up. We will get some more cases. As we do more testing, we will see more cases. So I think we all need to be mindful of that. This is not going to be a quick fix for this. Yeah. We've seen our business start to come back again pretty quickly, probably quicker than we thought it would, because hospitals are looking for ways to save money. And using reprocessed product in an AFib procedure, which is in our space, can save the hospital over $3,000 per case. So these are pretty substantial numbers. And hospitals have to look, like I said, labor and supply. And we saw what happened with our labor pool during this COVID. I mean, a lot of our nurses and healthcare workers really had to step up and stretch those resources more, because there's just not enough of them. I don't know how many more resources we can cut at the healthcare delivery level and still have a manageable system.
Well, Rick, you're an insightful and a passionate guy, and I very much appreciate you spending time with us. Thank you for joining us.
Bill, thank you very much. Have a great day and be safe.